So I
Hmm.
think it's one of those things that people need to understand that, you know, getting sick isn't suddenly, this curse of things. Everyone deals with periods in their life where they have downturns. It's how
Hmm.
you bounce back out of that and that you don't stay in that, sick place and become chronically ill. And that becomes the permanent we talked about. But a lot of people are told it's permanent, right? Especially when you're dealing with children, because you go then to the pediatrician, you go to the specialist that find the diagnoses based off the symptoms and then say, well, this is a permanent. We don't have solutions for that.
Hmm.
What are you telling parents in that respect with documenting hope and all the work you're doing about, hey, this doesn't have to be, I know your doctor told you that, but there are other options and solutions out there where this doesn't have to be permanent.
Yeah.
How do you get into that with parents? Because I feel that's a big one because once they hear their doctor is their everything. They have so much trust in it that they say, oh, well, it's permanent.
Right. No, and it's tough because we want to trust our doctors. I
You
mean,
do.
I've had doctors for myself and my kids that I've implicitly trusted, but we have to remember that they had, one lane of training. And they may not have had the training that some other doctors or other types of practitioners have had that give them a different perspective. So I think we have to give our conventionally trained physicians grace because they know how to do a lot of stuff that's like acute medicine and surgery and all these things that are so important, but they weren't trained to deal with lifestyle driven chronic illness. They just
No.
weren't.
Right.
So there are all kinds of traditional methods and traditions like traditional Chinese medicine, Ayurveda, like all these amazing practices out there that were trained to look at the body and how does it get in and out of a state of disease. The thing that I think compels people towards that other model is the stories.
Hmm.
So there are thousands of anecdotal stories
Yep.
of people reversing all kinds of chronic conditions. And this
Yep.
is what documenting hope is about, is taking these anecdotes, these things we've heard about autism being fully reversed, rheumatoid arthritis,
Hmm.
lupus, ADHD, diabetes, obesity, all of these conditions that most people, when they walk into their physician's office, will be told it's genetic, it's lifelong, here's a medication.
Yep.
But what do these anecdotal stories of reversal mean then? Are they not true? Are they made up? Of course not. It's just that nobody's studying them or nobody's trying to understand what happened. So we set out to better understand them. So I've been collecting stories of all kinds of recovery for 15 years.
Hmm.
We've documented them, written the stories up. We have them on film. And we're studying that process. We have another study. It's called the flight study, where we're actually doing an intervention study where we're taking a small group of children who have a chronic health condition, and and it's a prospective longitudinal study where we're enrolling them when they're sick, and we're helping them, we're facilitating their access to integrative holistic type practitioners and supports, and we're documenting their healing journey. Like what does it take to heal a kid from
Yep.
ADHD? What does it take to reverse autism? And we are learning so much. We know about so many amazing tools that are out there. They just haven't gone mainstream yet. So this is what I live for, is trying to bring all of these anecdotes into the mainstream. We call it mainstreaming miracles, right?
Hmm.
Because that's what's happening. People are like, oh my God, this child was a severe nonverbal autistic child at age 4. And now he's going to a top university, has tons of friends and a girlfriend. Like, why is that not the standard of care? Like, why are we not examining those stories to get every little piece of detail about what that parent did with that child to get them from the point where they had a severe diagnosis to the point where they're completely a miracle in everybody else's eyes? So we are doing this work to try and document it, learn from these anecdotes, and then scale it and get this information out to people so they know what to do when they get
Yeah.
that diagnosis.
I find that so critically important. Usually, when I speak to any patient that's been giving a diagnosis that's so called incurable, the one thing they really want to hear more than even the evidence, because the evidence led them to believe it's incurable, because that's what conventional medicine has said and been able to give them through their evidence. But the other side of that is the anecdotal side of those stories that doesn't have to be the truth. They're looking for someone else out there, not a plot and a study, to be able to say someone was like me and got better. That to
Mhm.
me gives me hope. That gives
Mhm.
me the ability and a purpose to move and keep trying rather than just sit here in this kind of lifelong sentence of kind of misery and suffering. And
Mhm.
so that's what I've always loved about kind of sharing other people's stories, and I'm sure you do as well, is that that one story impacts so many others that were in that place, and to begin with, to say, if they could do it, I could do it too.
Mhm.
So with that said, Beth, do you have any stories that really stick out for you that are just like, hey, this is a story I tell a lot of people that really was one of inspiration and hope?
There are so many, I can't even
Yeah.
tell you. I mean, I think the most stories that I've collected over the years are in in autism in particular,
Mhm.
because autism is a complex condition, no doubt,
Oh,
and
yeah.
it's heterogeneous. It's like they say, if you've met one kid with autism, you've met one kid with autism, meaning that there are
Mhm.
some cases that are, easier to resolve than other cases. There's all kinds of variables and complexity, but the parents that have a child with autism who are severely impacted, either nonverbal or have some kind of behavioral issues, maybe they're self-injurious, like something that is just breaking the parent, just breaking them. They are the most motivated, courageous. They have so much grit. These parents are amazing. They will stop at nothing to help their children. And so I've heard so many stories of, like, we have on our websites, we have stories of kids who had no language. There's one we just shared. We did a video and we shared it at our conference we had in November. This child had no language. He was diagnosed as severely autistic at 3 years old. And his mom, he had, talk about self-injurious behaviors. He was hitting his head all the time.
Mm.
He had the stereotypical stimming, flapping, those kinds of things. And his mom followed the GAPS diet, the gut
Mhm.
and psychology syndrome, Natasha Campbell McBride, which is basically, she worked on healing the gut and just worked on getting nutrient dense food into him. And she did some other kinds of, holistic therapies with him. And now he's a teenager and he's great. He's doing great. And his mom actually trains other parents. She's become a health coach and she's trained other parents how to implement the GAPS diet in their home. So I would say, like, that's one story. We have recorded some of these on our videos. So on our Instagram and YouTube, we have these videos and people can go in and watch them. But what's interesting to me, and the thing that I've been really compelled to better understand, is, what do all these stories have in common?
Mhm.
And I do not know one single story of, condition reversal where the gut and the diet wasn't a centerpiece. And
Absolutely.
so a lot of times I hear, especially in the autism community, people will say, well, I tried the gluten-free, casein-free diet and it didn't work. Or, I tried taking out, dairy and it didn't work. Like, that's not what diet is. Diet
Yeah.
is like
Yeah.
comprehensive, just putting only nutrient dense food in, healing the gut, doing some real intensive repair there, because kids who got to that point have such damaged gastrointestinal tracts that you really need to do intensive repair work.
Yeah.
So that's a through line, and that's one of many. Detoxification would be another through line.
Absolutely.
Um, Calming the nervous system, like finding ways. There's a million ways to calm the nervous system, as you
Yeah.
know.
Yeah.
So that's another through line in all these stories. So to me, that where we're going with this is, we're collecting the stories, we're collecting the data, we're testing a hypothesis about how healing happens. But at the end of the day, what we're trying to get to is here's the recipe, not
Mhm.
the protocol. I don't believe in protocols because I believe
Right.
in bioindividualism, and everybody's path to sickness is going to look different and their path back to health is going to look different. But there is a recipe, and the recipe is, going back to what we originally talked about, getting as close to nature as possible,
Yeah.
get back in those rhythms, eat food that your body needs, to correct the deficiencies that have accumulated over time. So,
Mhm.
we're getting closer to being able to do that in a structured way to help people so they don't feel so overwhelmed.
Yeah. No, there are absolutely patterns out there. I truly believe in personalization and tailored, treatments. Generalized blanket protocols just don't work. We are
Mhm.
so individual. The root causes and underlying, dysfunctions of us are so unique to us that you can't just throw a protocol at everyone, expect it to win. So, but there are patterns, like you said. If help the gut out, if you detoxify and all these things, if you turn more to nature in general, you will see better outcomes. And it
Mhm.
is that starting point to me is always like, what are you putting in on a daily basis to nourish or to harm? And most of the times it is harm.